Greetings! Welcome back. In this video, we are going to deviate from normal lymphatic and immune system function and veer off into the exciting world of the abnormal, when good systems go wrong. Dun, dun, dun. So, what happens when the immune system is partially compromised or completely absent? Disease! Specifically known as immunodeficiencies, this class of disorders is caused by a partial or complete failure of all or part of the normal immune response. Immunodeficiencies can be inherited or acquired. Inherited means it has a genetic basis, while acquired means it is something that you get during your lifetime. One example of an inherited immunodeficiency is severe combined immunodeficiency disease. In this disorder, multiple genetic defects result in failure of both the B and the T cells. Previously, people with severe combined immunodeficiency disease rarely survived past 1 year of life and eventually succumbed to opportunistic infections from a complete failure of the immune system. However, we now have much better success treating these patients using bone marrow transplants and gene therapy. Super! One example of an acquired immunodeficiency is human immunodeficiency virus, or HIV, and AIDS. AIDS literally stands for acquired immunodeficiency syndrome. In this case, the virus that causes HIV is capable of completely wiping out your immune system and leads to AIDS. Treatment was also once unavailable, but new antiviral therapies are significantly prolonging lifespan and even achieving untraceable levels of virus. Amazing! Up next, what happens when the immune system overreacts? These disorders are collectively known as hypersensitivities and come in 4 basic forms. In type 1 hypersensitivities, these occur in response to an allergen or antigens that cause an allergic response. These are commonly diagnosed as allergies or allergic asthma and are due to the immunoglobulin IgE. Also known as immediate hypersensitivity, a response to an allergen can be generated in a matter of just a few minutes and includes symptoms like a runny nose, sneezing, and watery eyes as the body attempts to rid itself of the offending particles. Most allergies resolve themselves after the offending agent is removed or can be treated with antihistamine medications. However, severe allergies can lead to anaphylactic shock, which can be fatal in 20 to 30 minutes. EpiPens, or automatic epinephrine injectors, are key to prevent severe allergic reactions. Type 2 hypersensitivities happen due to IgG-mediated cell lysis and are a common result of mismatched blood transfusions. For this reason, patients should be type and crossed prior to receiving any donor blood. Type 3 hypersensitivities occur when a disease process results in an accumulation of antigens and antibodies which accumulate in the blood and then block blood vessels, typically in the kidneys, joints, and other organs. This activates complement proteins and causes inflammation as seen in conditions like systemic lupus erythematosus. Type 4 hypersensitivities are also known as delayed hypersensitivities. The first exposure to the antigen is called sensitization, and subsequent exposures result in super dramatic responses. Responses of higher magnitude. So dramatic. Type 4 sensitivities are the basis behind TB or tuberculosis testing. A small amount of antigen is injected just below the skin. If you have previously been exposed to or had TB, the body will respond dramatically with a raised red area of anger. If not, it becomes a non-event and your test is negative. Autoimmune responses or autoimmune diseases are the most severe forms of immune system overreactions. This happens when tolerance of your own tissues and cells fails. Examples of autoimmune diseases include things like rheumatoid arthritis, celiac disease, and type 1 diabetes. We know that environmental triggers can play a large role in autoimmune responses, particularly after certain bacterial infections. Another theory, called the hygiene hypothesis, proposes that having multiple common infectious diseases can prevent autoimmune responses, as autoimmune issues are exceedingly rare in countries with a high incidence of infectious disease. In other words, some people think that being too hygienic and preventing the normal development of the immune system from exposure to typical infectious diseases could actually trigger autoimmune disease. Fascinating. We also know that genetic factors play a role as well. Regardless of the cause, we mainly treat these disorders with immunosuppressive drugs and anti-inflammatories that come with a host of side effects themselves. So go cure autoimmune disorders. Now let's talk about tissue typing. Not like the click, click, click typing of you taking copious amounts of anatomy and physiology notes, but like the antigen testing. Tissue typing is how we determine the major histocompatibility complex molecules of tissues to be transplanted. This happens in an attempt to prevent tissue or organ rejection by the donor, where their body mounts a huge immune response and refuses to see the donation as self. Bad. You have probably heard of the typing of red blood cells based on their ABO surface antigens, which lead to the A, B, AB, and O blood types. However, the Rh antigen is equally important. People who have the Rh antigen are labeled as Rh positive, and if they do not, they are Rh negative and do not have this molecule. When we combine the two systems, we get the A positive negative, B positive negative, AB positive negative, and O positive negative blood types. Bet you can guess my blood type. It's also my life motto, B positive. The Rh antigen is a particular concern during pregnancy. If the mom is Rh negative but carries Rh positive children, her body can view the fetal red blood cells as foreign and mount an attack. This condition, known as erythroblastosis fetalis, gets worse with subsequent pregnancies, but can be treated with antibodies if diagnosed appropriately. Insert plug for good prenatal care here. Matching tissues and organs for transplantation gets more complicated than blood transfusions. If the MHC molecules are incompatible, the tissue will be rejected. The donation was in vain and the patient is right back where they started. The two main characteristics of MHC molecules that need to be tested are MHC polygyny, or the multiple MHC proteins on cells, and MHC polymorphism, or multiple alleles for each individual MHC locus. In bone marrow transplants, a mismatch can lead to graft versus host disease, in which the transplanted cells mount an immune response against the recipient. Symptoms can include a rash and liver damage. In other words, the donated immune cells in the bone marrow attack the host. Ouch! Moral of the story: just as in your romantic and business relationships, make sure you do your research first and make a good match. Well, that does it for lymphatic and immune system diseases and disorders. See you next time.